Well, thank you everybody for joining us tonight. Welcome to Kidney Cancer and Gut Health, our town hall, our third town hall for the year. And thank you to the audience for joining us tonight. We have 128 registrants from 32 states and 9 countries, including Poland and Australia, Canada, the UK, Germany, Kuwait, and even Uganda. So thanks for joining us from around the globe. We know it's an odd time for some of you, so thank you. But first of all, I would be remiss if I didn't say a big giant thank you to all of those who took part with our grassroots army back on September 24th and 25th and advocated for the $60 million for the Kidney Cancer Research Program. A giant, huge thank you. Our voices continuing to be heard. Our next spring advocacy days are going to be scheduled for March 10th and 11th, 2025. Get out your calendars, March 10th and 11th. And we encourage everyone in the audience to use their voice to advocate for kidney cancer research funding. For more information on how to get involved, please email our legislative patient advocate, Deborah Bayan. Her email address will be dropped right in the chat for you to reach out to Deborah, please. And so tonight, here comes my Alex Trebek. We're going to be covering several topics, including diet and nutrition, supplements, the gut microbiome, managing GI side effects of treatment, and strategies to avoid weight loss during cancer care. So this town hall will be available on our YouTube channel in the next few days. Look for an email with the link. And a big giant thank you to our sponsors, Aveo, BMS, ASI, Exelixis, and Merck. But the biggest thank you goes to our panelists who are coming up right now. Dr. Rana McKay, she's a medical oncologist at the University of California at San Diego. And Ms. Archana Ajmera, an adult nurse practitioner specializing in oncology at the University of California, San Diego. So here we go. So Dr. McKay, tell everybody exactly what you mean by the word gut and where and what organs does that include?
Oh, absolutely. Well, it's a pleasure to be here, Brian. Thank you so much for the wonderful introduction. So, what is meant by gut? It is the digestive system that processes foods and absorbs nutrients. It's basically starts from the mouth and goes all the way through to the anus. And it's a complex ecosystem really containing trillions of microorganisms. It's actually received the term the second brain because of the extensive nervous system network that's part of the gut. So if we think about the organs that are included in the gut, starting from the mouth, we go down into the esophagus, which is basically the tube that carries food down into the stomach. And then after the stomach, we go into the small intestine, which has 3 parts, the duodenum, jejunum, and ileum. And then we go into the large intestine or the colon, which most people are familiar with. And then finally, the rectum and the anus. And there are organs that support the gut, like the liver and the pancreas and the gallbladder. And these organs, particularly the pancreas and gallbladder, help with generating digestive enzymes that help with digesting the food that we eat.
Got it. Got it. So now start putting the pieces of the puzzle together. What's the connection between kidney cancer and making sure that your gut health is okay?
Very good question. So the gut houses approximately 70 to 80% of our immune system. And this can actually impact treatment. It can impact immunotherapy efficacy, potentially. The treatments that we receive can actually disrupt the gut flora, particularly the tyrosine kinase inhibitors that can cause GI side effects. Additionally, the immunotherapies can cause GI side effects, whether it be colitis, which is inflammation of the intestines, or pancreatitis, which is inflammation of the pancreas. And so, this is sort of the interplay between the gut and kidney cancer. A healthy gut is important during therapy because I think it allows for people to have better treatment tolerance, improved immune responses, better absorption of nutrients. Diet is so critically important and maintaining good nutritional intake is important. And if the gut is negatively impacted, it could affect the way that we actually absorb the foods that we eat. And, ensuring a healthy gut is critical to kind of decreasing the risk of complications when on any given therapy.
Got it. Got it. Archana, I'm going to jump off script here a little bit and ask you, could you tell us a little bit about your meeting with patients and then talking to them about their diet and nutrition once they might be going on in therapy? Could you talk a little bit about your role as well as the role that the gut plays in slowing down or maybe potentially aiding therapies?
Yeah, of course. So I'm a nurse practitioner. So my background is nursing, and then I, obtained a master's degree that allows me to participate and collaborate with the oncologist to manage treatment toxicities, sort of implement the treatment course that's established by the oncologist. So Dr. McKay and I work very closely together. So, after she's established a treatment plan, then I can help execute that treatment plan is sort of how I explain it. But we really work very collaboratively together, kind of alternating visits back and forth. So a lot of what comes up during visits when I see patients is toxicity or side effect management. So when patients are getting therapies for their kidney cancer, we talk a lot about how it's impacting, their day-to-day life. And many of our conversations are around, managing GI symptoms, managing their diet, managing the loss of taste, or changes in their taste buds. And so this is really kind of integral to our conversation regularly as we're managing these patients.
Great. Thank you very much. We're going to have our first questions coming live from Mark. Mark, let's hear what you have to ask.
Okay, thank you. My question is, are there any special diets to help preserve kidney function, such as keto, high protein, Mediterranean, plant-based, or intermittent fasting? And on the other hand, are there any that may be harmful?
Very good question. So I think there's a lot of fad diets that are out there. I think as we speak about all of these diets, maybe we can summarize them a little bit and then talk about what's the best strategy. And the first thing that I will say is there's this interesting concept in kidney cancer. And while we think of diets around weight loss and weight management, in kidney cancer, there's this phenomena called the obesity paradox. While increased weight is associated with the development of kidney cancer and can be a risk factor for developing kidney cancer, across multiple data sets, we've actually identified that actually patients who are at weight or overweight actually have better outcomes compared to people who are malnourished or underweight, especially in the metastatic disease context. So I think this is something that's important as we think about what is the purpose of any given diet that somebody is on. The purpose is to ensure that you are actually getting the adequate nutrients that you need and you're getting the energy that you need. Calories equal energy. And so when we think about diets, that's critically important when we think about why we eat the certain foods that we eat. I think a Mediterranean diet is an excellent diet for somebody with kidney cancer to adopt. It's a diet that's rich in whole foods, protein, predominantly fish-based, as opposed to, red meat or beef-based. Lots of vegetables, lots of grains, lots of fruits and nuts are good things to consider. When we think about a keto diet, this is a diet that's really very, very limited with regards to its carbohydrate intake, which can sometimes be challenging for patients that have kidney cancer because sometimes you need glucose. Glucose is a form of immediate energy. And, every cell in your body needs glucose. And some keto diets that are so devoid of carbohydrates result in patients really having not a lot of energy because they don't have that fuel. So I think, there's limited data on keto diets specifically in kidney cancer, though they are being studied. Plant-based diets, I think, are excellent to consider. I think sometimes the problem with plant-based diets, if you're not careful, is you end up being a carbivore because you end up eating a lot of carbohydrates and it's really hard to get the protein intake in, which you need for muscle mass development, and is something to sort of monitor. So I would cautious around plant-based diets to make sure that you're actually working with a nutritionist to make sure you get enough protein intake in. And sometimes plant-based diets, when people are on tyrosine kinase inhibitors or on immunotherapy, the fruits and vegetables, which is excellent, can actually exacerbate diarrhea and exacerbate GI symptoms. So we have to be cautious about that when people are on a plant-based diet. I think intermittent fasting certainly can be considered, but again, you have to understand what is the purpose of the diet. Is the purpose of the diet to ensure I'm getting good nutrients and I'm building muscle mass? Is the purpose of the diet weight loss? what is the actual purpose? You know, I caution around intermittent fasting because people tend to get pretty dehydrated with intermittent fasting, and just have to be careful around ensuring that you're getting adequate nutrition. And then the last item to touch on is like the high protein diet. While high protein diet is a very good diet in general for people who have metastatic cancer, we do have to weigh the amount of protein intake that somebody takes in when they have kidney dysfunction. So for people who have their kidney removed and their kidney clearance isn't great, their kidney function is poor, very high protein diets can actually damage the kidney. And so we need to be cautious a little bit around that as we're considering a high protein diet. So I think at the end of the day, the recommendation that I make for most patients is a balanced diet with whole foods, lots of fruits and vegetables, grains, things that you make in the house, lack of processed foods, that can really be associated with, you know, increased salt intake and other things like that, you know, homemade, whole food, Mediterranean style diet.
Excellent. Mark, thank you very much for that question. Archana, a follow-up on that is there's a lot of talk on the internet about superfoods. Can you talk about some of the common misconceptions about these?
Yeah, so I think a lot of the superfood conversation, or at least some of the conversation that, I think is out there, is that superfoods, and I think this goes back to Dr. McKay's point about kind of what is the purpose of that particular food that you're trying to take in. And, there's some conversation that superfoods can help with losing weight, but actually, if you think about some of the superfoods out there, like avocado, for example, they're very high calorically. And, a lot of the superfoods include nuts and grains, legumes, and those are also foods that can cause a lot of GI distress for patients who, for example, are on tyrosine kinase inhibitors. So I think it is balanced, to Dr. McKay's earlier point. And I think, one strategy or sort of practical way to think about sort of constructing a meal is you think about any given meal, and in an ideal situation, half your plate is fruits and veggies, a quarter is lean meats, and a quarter is, whole grain, something whole grain. And that's sort of a construct that I often recommend to patients. With that said, we have to consider the symptomatology going on, right? And so that's always not the perfect scenario for everybody. But I don't know, Dr. McKay, what you have to add to that.
Yeah, I mean, I think, to share is there's no single food that is going to cure cancer. I think I think there's a lot of marketing that I think happens around, diets, especially superfoods. Like superfoods, it's a marketing term. It's not a medical term. So generally it's associated with foods that are associated with a lot of nutrients, vitamins, antioxidants. I think balance is key. I tell patients, go to the source. Don't necessarily go to, like, if you want to take turmeric, for example, or ginger, make ginger tea, get real ginger, put it in your water, make a tea. Don't go get a ginger tablet and who knows what's in that tablet. Or if you want to incorporate turmeric in your diet, incorporate the spice into the food that you're eating. So go to the natural source, as opposed to getting a tablet that you don't know what kind of filler substance is in that. And all of these nutraceuticals, if you will, it's a totally non-regulated industry. So you just have to be careful what's out there.
Good. Thank you for that clarification. We have another live question coming up. Lori, we're going to bring you up and let you ask your question.
Hi, thank you. How do you balance low sodium, potassium, and sugar and maintain a healthy diet with one kidney when you're on a TKI?
Yeah, very good question, Lori. And I think this is something that's critically unique for our patients with kidney cancer because of the fact that most individuals have had a prior nephrectomy. They only have one kidney. They may have some kidney dysfunction, and then they're dealing with treatments that can affect their ability to taste food that is good. And so what they actually have an appetite to eat varies from what is probably like recommended in any given diet. And then the side effects that can be associated with the drugs that they're on. So I think working with a dietitian is really a good thing, actually, to help develop a diet plan and nutrition plan that's going to make sense for any one given patient. around the specific therapy that they're on. I think it does require, consistent monitoring of people's blood work, making sure their electrolytes are in check, checking their sodium and potassium and calcium levels and phosphorus levels, depending on the degree of kidney function that they may have. I think, generally with kidney diets, we tend to consider, the salt intake, which can really exacerbate hypertension when people are on a TKI or have kidney dysfunction. So we generally guard against that. There's a lot of salt alternatives like Mrs. Dash and other kind of alternatives that actually will give flavor to the food, but don't necessarily have that added salt. I think the other thing, like I mentioned earlier about the protein intake, very, very high protein intake is probably not a good thing for somebody who has already kidney dysfunction. So that's something to kind of, guard against, when developing a diet with, only one kidney in place. And hydration, I think, is really important. I think there's almost like a bell-shaped curve with hydration, because people who are on the extreme of tremendous kidney dysfunction, you actually want to sometimes restrict the amount of fluid they eat because they have trouble getting rid of the excess fluid because their kidneys don't work great. But I think people that are on the early side of the kidney dysfunction, we want to encourage a lot of hydration to keep that kidney nice and healthy, particularly around the time that they're having maybe exacerbated diarrhea, or maybe when they're getting a scan with any sort of contrast. Like, lots of hydration is really important.
Great. Thank you, Lori. Appreciate that question. We're going to shift gears to the topic of supplements, and we've got a question coming from Missouri from Paige. Paige, you going to join us and ask your question, please?
Sure. What supplements are helpful or harmful in maintaining kidney health?
Very good question. So I think as we talk about supplements, I think it also depends on the degree of kidney dysfunction that any one given patient may have. The kidney is actually a critical organ that's responsible for calcium and phosphate regulation. And so some people may have high or low levels of calcium or phosphate, depending on where they're at in their disease trajectory, not kidney cancer, but rather kidney dysfunction. So I think ensuring that there's appropriate calcium intake, generally people tend to have higher phosphate levels when their kidneys don't work well, but if they're having a lot of diarrhea, they may have low phosphate levels. So it's going to depend on sort of that individual's situation. I think there are supplements that we need to just be careful about. There's some herbal supplements that can actually increase people's clotting risk and put strain on the kidney. So being careful around those. High-dose vitamin A, high-dose vitamin E, probably not great for people with kidney cancer. B-complex vitamin D, omega-3s, probably good supplements. But as I say, go to the source, get it from your foods, like, eat salmon for omega-3 as opposed to taking a pill. So there's different things that we can do in our diets.
I think the key too is that, always talk to your provider about if you're considering any supplementation, because many of these supplements have interactions with the drugs that we prescribe for the kidney cancer. And so we want to always kind of vet those before you start.
Thank you very much, Paige. Archana, some patients ask about using fenbendazole as a supplement. Can you talk about that at all?
I might defer that one to Dr. McKay. She probably knows a little bit more than I can.
I'm happy to speak to it. So fenbendazole is a dewormer. It's actually an antiparasitic medication used in veterinary medicine. It's not approved for human cancer treatment at all. There's very limited clinical data of its actual utility or benefit with regards to patients who have kidney cancer. There's been various controversial preclinical data about its activity in a petri dish of what it may actually do for somebody for a kidney tumor. But I think these are azole medications. They tend to have a lot of drug-drug interactions, particularly with tyrosine kinase inhibitors. So I would be very, very cautious about the use of these agents and the potential GI tox and toxicity with TKIs.
All right. Well, thank you for that question. So why should kidney cancer patients in general discuss supplements, including multivitamins, with you all before getting started on it?
Yeah, I think Archana was alluding this here. I think it's critically important because of the potential interaction with somebody's cancer therapy, particularly the TKIs, where there's a lot of just drug-drug interactions. There's different enzymes that metabolize the different agents that people are on, and some of the supplements that somebody may be taking could actually decrease the cancer therapy levels in somebody's system or increase them, and then there's significantly more toxicity. So I think making sure to run through your supplement list with your clinician is really important. And a lot of times we actually lean on our pharmacists. Like we have our pharmacist review patients' alternative, complementary therapies that they may be on. Some could increase the risk of clotting. Many kidney cancer patients may already be on a blood thinner because of a prior clot or risk of a clot. So I think those are particularly important items to discuss with your clinician. And the other thing, as we think about clinical trials and eligibility for clinical trials, there's certain drugs that are prohibited from being on when you're on a clinical trial, or they may require a certain washout period. And so that's important to discuss if you're thinking about participating in a clinical trial.
Archana, do you get asked quite a bit by patients about supplements?
Yes, very frequently.
Do you have a standard policy, like call us every time before you start, or how do?
Yeah, I mean, I do. I think particularly many of our patients who've been on and off clinical trials are familiar with that because both Dr. McKay and I are sort of on the same page about that discussion. But, and often, we become very integral in every aspect of people's care, right? They see us so frequently. So any new med changes, we're often notified, which is great. And so most patients will bring these things up, but we do remind everybody that, there's potential interactions. There's, as we know with some of the immunotherapy and TKI drugs, they have potential toxicity, or, potential to impact the liver. And we know that a lot of these supplements can do that as well. And because many of them are not studied to the degree that our medications are, they're not, they don't go through phase 3 clinical trials. We don't really know until we see it. But we've seen that and we've experienced that. And so again, we kind of caution everybody to let us know.
Great, thank you for that. And I think we're running a little bit ahead of time, so I'm going to dive into the next topic and try to get a couple of answers. First of all, topic number 3 is the gut microbiome. I think, Dr. McKay, microbiome, it's been a long time since I took my biology class.
So microbiome refers to the bacterial composition of the gut. So the gut actually has trillions of microorganisms that are living in our digestive tract. Actually, it's probably around 2 to 5 pounds of bacteria that live in our digestive tract. And the main function of the microbiome is to aid in digestion, produce vitamins, support the immune system. There has been data to suggest that it can actually influence treatment response. It can affect inflammation levels. So there's been a lot studied in the gut microbiome. And I think it plays a critical role in potentially response to treatment and side effects related to treatment.
So I think this topic's probably going to come around back to diet a little bit. So what can you do to be optimizing or taking care of your gut microbiome?
Yeah, no, very, very good question. So one is, eat a diversity of foods that are fiber rich. Also consider eating fermented foods. That's good to actually enhance the, bacterial milieu of the gut. And actually, there's been some data to suggest that patients who are on immunotherapy and receive antibiotics may potentially have inferior outcomes to patients who actually never receive antibiotics. And, there are some biases in those sorts of analyses because somebody receiving antibiotics may be, they have an infection. They may be sicker because they're receiving antibiotics. Is it the antibiotics or is it the sickness that's causing the worst outcomes? But there is this data out there that antibiotics can actually negatively impact the gut microbiome. If somebody needs antibiotics, they should receive antibiotics. That's not the messaging, but it can impact the gut microbiome. I think staying hydrated, limiting foods that are processed, limiting high sugar content foods, foods with very high glycemic index, exercise, stress, and sleep are so critically important to maintaining a healthy microbiome. Maintaining that circadian rhythm where you're getting good sleep at night, and kind of your body is in that regular flow is really important. And I think regular exercise, generally recommended 30 minutes of sustained activity, at least 5 days a week, is also important to maintaining that healthy gut microbiome.
Got it. Got it. I'll ask Archana, maybe you have the answer to this one. Are there any other fermented foods that people might recognize? I can think of kimchi maybe for
Yeah.
Korean food.
So some of the things I think of like prebiotics are sort of like kefir, yogurt, miso is another one. And then other things like probiotic, the way people think that the groups of foods that people think about are like legumes, fruits, and vegetables. So kind of two different categories, but I think, any kind of combination of these can be beneficial.
And if you're at the grocery store, is there anything that identifies anything, that we should be aware of or concerned about, or needs to have a stamp of some kind of approval, or there's nothing right yet?
No, I mean, most of, you know, I think some of it is also the marketing piece that Dr. McKay talked about earlier. They'll sort of label things as like a prebiotic or, but generally speaking, these are all, you identify, a good Greek yogurt or a kefir yogurt. I mean, those are all pretty uniform. I don't think you need to go for the extra prebiotic, version that's more expensive, that it's not going to necessarily add a whole lot of value. I don't know, Raina, if you have other thoughts on that, but
Yeah, I think as we think about prebiotics and probiotics, so prebiotics are foods for probiotics, while probiotics are actually live organisms. So there's certain yogurts, like Activia, for example, it actually has live bacterial culture in it. And so you can read the label and see like foods that actually have live, bacterial culture. Most of it is yogurts, quite honestly. Some of the fermented vegetables may have that, kefir, like Archana was saying. And then when we think about prebiotics, that's more of like your, garlic and onions and bananas and things like that. They're not actually live bacterial products. So there's a little bit of a distinction there.
Got it. Okay. And the takeaway is both pre and probiotics are good for you and helpful. Just don't overdo it on either one, probably.
yeah,
I mean, I worry sometimes because I worry that with a lot of probiotics
Yeah.
and prebiotics, it can actually exacerbate people's
Exactly.
diarrhea on a TKI. Like they may, you just got to be careful of what's going to work for you, and experiment. And, that's probably the recommendation. Everybody's going to have a different experience with the pre and probiotics.
Got it. Got it. We have someone coming in from overseas on to ask a question, and I think we may have lost them momentarily. So we'll just sort of keep going on this. Are there, in addition to the prebiotics and probiotics, are there, I guess, any other foods that you would like to see patients trying more often than they say they do or should?
I think very good question. I mean, I think it's not necessarily the type of foods. I think it's more, I would think of the macronutrients that people eat. The macronutrients that are in people's diets are protein, fats, and carbohydrates, and the different composition of those macronutrients that you eat in any given, day for your caloric needs, but also your nutritional needs. I don't think it's any one food per se, but a good balance of what's going to actually work for any given individual. And I will say, like, for some of our patients who, everything tastes like cardboard for them except for a smoothie, then I'm going to tell them eat smoothies. You know what I mean? Or everything, like people's tastes change when they're on a TKI. They may get a metal taste in their mouth. Salty foods, they may shift in the things that they like from having a more salt palate versus a more, sweet palate. So, there's no set predefined rules. I think it's experimenting to see what's going to work for you to make sure you get your nutritional needs taken care of that aren't going to exacerbate side effects.
Got it. Got it. Well, we haven't gotten our friend from overseas in Poland back on yet, so I'm gonna
just sorry, Brian. She's just landing with us. She's just coming back in now. Bear with me 2 seconds.
All right, no worries. Here she is now. Okay.
Hello, sorry, we've been having some difficulties with the connection. So my question is, could you discuss CBM 588 and the evidence it may help or hurt treatment responses? Should patients consider discussing off-label use with their physician?
Yeah, very, very good question. There's been a lot of work on CBM 588. CBM 588 is a live bacterial product containing Clostridium butyricum, which is a butyrate-producing spore bacteria in essence. And it was actually first isolated from the soils in Japan in 1962, and it's actually commonly used in various GI conditions in Japan. And there's been some really elegant studies that have been led by Dr. Monty Powell, who's going to be leading, I think, an upcoming seminar with you all in the future, but led by Dr. Powell, single institution investigator-initiated trials that have added CBM 588 to standard treatments. There was one study that looked at CBM 588 plus Nivo-IPI, and there was another study that looked at CBM 588 plus nivolumab and cabozantinib, so looking at it in the context of a TKI-based regimen. I think with the pure immunotherapy strategy, we saw from the early phase 1 study that there was actually significantly improved responses in the treatment arm that received CBM 588 compared to the control arm. Now, there are nuances. This is a small study, small sample size. The primary endpoint of the trial was actually looking at changes in the gut microbiome into a more favorable, gut profile. And actually, the use of CBM 588 did in fact do that. It actually resulted in kind of a more favorable bacterial milieu within the gut. As a result of these 2 investigator-initiated studies, there's now actually a large phase 3 study that's being designed through the cooperative groups, looking to actually more formally answer that question of does the utilization of CBM 588 augment outcomes for people receiving immunotherapy-based combinations. So I think it's promising. It's got very limited side effect profile, and something that's very easy and very cheap for people to take and use.
Great, thank you, and thank you for your question from over in Poland. We're going to shift gears a little bit here, and I'm going to ask an introductory question. This is on GI, which is gastroenterology. Is it possible to do a quick, what's the difference between GU and GI for those who are listening?
Ajmera, you want to take that one on?
Sure, yeah. So the GI tract is what Dr. McKay kind of started to describe, which is sort of the pathway from the mouth to the anus. So your mouth, esophagus, into the stomach, through the bowels. The GU system is really kind of the kidneys, the bladder, all the way down the urethra, sort of the urinary excretion pathway. So that's the GU pathway. Let's start with that.
Okay, all right. And so we're going to be talking a little bit more in depth about the side effects of TKIs, diarrhea, taste aberrations, etc. For those who might not know, do you want to, Dr. McKay, give a brief overview of what TKIs for those who might not fully know what that means?
So TKIs are tyrosine kinase inhibitors. What that means is that there are certain receptors that are on the surface of a given cell. And when those receptors are engaged and active, they actually turn on different pathways within the cell. And a lot of times they actually turn on growth pathways within the cancer cell. One of the receptors that's critically important is the VEGF receptor, which is the vascular endothelial growth factor receptor. It's critically important in kidney cancer. And when that pathway is turned on and upregulated, which is very common in kidney cancer, it can result in cancer spread, cancer growth, blood vessel growth and formation. That's why kidney tumors tend to be very vascular tumors. So these VEGF inhibitors actually block the receptor and turn it off. They bind to it and block the activity of the receptor. Now, this receptor is not just found on kidney cancer cells, it's actually found on other parts of the body, which is why people have toxicity to TKIs, the hypertension, the diarrhea, the hand-foot syndrome that can classically happen when people are on tyrosine kinase inhibitors. There's a lot of them that are out there. The very first one to get FDA approved was sorafenib, and the other one very shortly after that was sunitinib. We generally don't use a lot of sunitinib nowadays, though it was historically like the gold standard workhorse for treatment of kidney cancer. Other drugs that you all may be familiar with include cabozantinib, lenvatinib, axitinib, tivozanib. These are all in the class of tyrosine kinase inhibitors.
Great. All right. And those, if I'm getting it correctly, are the guilty parties for causing a lot of people GI issues when they're on the therapy. And so are there specific foods or drugs that you can suggest to help manage those symptoms if folks have them?
Yeah, I can start to kind of describe that. So, I think one of the things we start to talk about, we counsel patients from the get-go that you could have really quite a spectrum of GI symptoms, right? So it could be reflux, it could be gas, pain, or bloating, it could be diarrhea. And so a lot of what we need to work with each individual on is sort of where they are on that spectrum and what are the symptoms that they're experiencing. And so we often, if patients come in reporting diarrhea or bloating or reflux, we first start talking about, okay, well, what can we do to manage your diet? Okay, what are the types of foods that you're eating? So what we know is there, cruciferous vegetables, for example, broccoli, cauliflower, bok choy, cabbage, like those are very gas-producing foods. If you talk to a gastroenterologist, they'll talk to you about the FODMAP diet. So the FODMAP diet are foods that if you follow a high FODMAP diet, those are very gas-producing foods. So we talk about a low FODMAP diet or low gas-producing diet. And which is tough because a lot of times the conversation I have is, well, those are all the healthy things. Those are all that's the salad, that I'm trying to make to stay healthy and have a balanced diet. But that's where we have to kind of navigate, well, what are the ones that are really triggering for you? And so creating a food diary is a good place to start, right? Start to try to find your triggers. And then avoid those and try other foods, things that maybe you haven't used in the past. And we're really lucky we have a dietitian that we work with that we can kind of refer patients over to help, sort that out, as well as offer suggestions of foods that perhaps you haven't necessarily been exposed to. But oftentimes I'll print out a list of examples of different foods that patients should avoid or patients could try as alternatives. Other things to avoid, might be fried or high fat foods. Things that have a lot of sugar in them can also be triggers. Carbonation, high fiber foods we talked about. And so those are sort of, and then for some people, dairy. So lactose-based products can also be triggers.
Wonderful. Thank you for that explanation. We have another question coming in from the great state of Ohio. So let's see if Ryan's out there.
Yes, thank you for that. And actually, Archana, you kind of hit on some of the question now, so I'll alter it just slightly. It has to do with bloating and gas on a TKI. You mentioned the FODMAP and the diet. Are there over-the-counters in particular that work really good for that bloating and gas, or anything else for the bloating and gas minus the dietary suggestions?
Yeah, that's a great question. So definitely there's over-the-counter simethicone, which is a gas, sort of the way that medication works, it actually helps kind of dissipate the gas, so it breaks it up so that it's not so painful and causing abdominal distension. So hopefully allowing people to pass the gas. The other thing that I didn't talk about though is exercise. So actually movement, right? Getting up and moving around, walking, every day, as Dr. McKay mentioned earlier, really can impact this positively, whether it's, not only with energy, we know that exercise helps with energy and fatigue is a common side effect, but also for gas pain.
And happy to add a little bit more to that. I think that there's a question in the chat about, is it a prescription? It's not. It's actually over the counter, and it's even used in babies with colic, to help fix gas. Other things to consider: eating upright, staying upright after eating meals, eating small, frequent meals as opposed to, eating large, meals per day. I think sometimes the intermittent fasting approach, people tend to eat one large meal or two very large meals. I think, breaking it up and eating kind of gradually throughout the day. Peppermint tea can sometimes actually help soothe the stomach. Actually, peppermint in general helps soothe the stomach. And it's interesting, peppermint, a lot of times, you go to a restaurant and there's, pick up your peppermint when you're leaving. You think you're just going to make your breath smell better. But actually, what peppermint does is it contracts the sphincter at the end of the esophagus and prevents the reflux of food back into the esophagus after people eat. So that's why it actually tends to be helpful with regards to, preventing GERD and reflux and kind of soothing the stomach. So I think those are additional things in addition to the food themselves and the medicines themselves that can be used to help with gas.
Thank you.
All right. Well, thank you, Ryan. Appreciate that question from Ohio. And now I know what those peppermints are for. All right. And we also have another question from Indiana coming up. I think Jim's out there. Jim, there he is.
Hi, Brian.
Hey, Jim.
My question is this. Are there any new ideas to manage low-grade nausea other than the usual mint and ginger teas?
Yeah, happy to take that on. I think there's a lot of things that could potentially be considered. Acupuncture, there's been some data to suggest that actually helps with nausea. Cold foods, cold beverages can sometimes help with nausea. There's certain aromatherapy of frankincense, again, peppermint, essential oils. Limiting to small, frequent meals throughout the day is a good thing to consider. I think the other thing too is anti-nausea medicines, antiemetics. So there's a lot of them that are out there. Zofran, Compazine, a lot that could potentially be used on Danzatron, Ativan, depending on the type of nausea that people are experiencing. And I think being proactive about the nausea to allow people to actually eat and get food in is really a good strategy. Sometimes when it already has taken place, it's hard to get ahead of it. The other thing that I'll say is there are some anti-nausea medicines that are disposables under the tongue. So like for people that are actually having active vomiting and you're worried about like actually being able to keep the tablets down, there's Zofran or Ondansetron comes in at a dissolvable under the tongue tablet that could be utilized. And then there's a lot of blood vessels actually underneath the tongue, and it gets into the bloodstream pretty quickly. So these are other things to consider around nausea management. Archana, not sure if you have others to add. Yeah.
Yeah, no, I agree. I think one other thing that we often talk about is hydration status. So patients who are having diarrhea can't keep up with sort of the oral intake and the hydration needs. As a result, the nausea can perpetuate itself. So to Dr. McKay's earlier point about kind of staying ahead of it, it's very difficult to break that nausea cycle. So a lot of times we talk about sort of proactively managing it with some of the medications she mentioned earlier to try to stay ahead of it. That way you can catch up with your oral intake and then it sort of abates. So lots of different strategies to talk through.
I think the other thing about nausea too is making sure that we're ruling out other causes of nausea. Sometimes while we think it may be just related to the TKI, certain immunotherapies can cause people to be nauseous, whether it be that they have pancreatitis or whether it be that they just don't have enough cortisol in their system. Some of the first manifestation is feeling super tired and feeling abdominal pain and feeling sick to your stomach. So I think making sure to tease out, letting your doctor know so that if there is a diagnostic workup, to rule out something else, like that's going to be important, as opposed to just treating with just supportive therapies without determining what the underlying cause of the nausea is.
Got it. Good. Thank you, Jim. Really appreciate that question. We also had a question that came up. I'm just throwing it out there. What tips can help patients dealing with taste changes or a metallic taste in their mouth as a side effect of treatment?
Yeah,
Go ahead, Archana. Yeah.
I was going to say, I'm happy to start. I think it really depends on what the taste is, right? So for some patients, it's the metallic taste. And so then you sort of steer towards kind of more on the sweet side of things, like cantaloupes, watermelon, things that are, more, hydrating in that way. Sour flavors like citrus tend to work well. Or, more spiced. So like garlic and salt and using sort of some of the herbal sort of, not herbal, excuse me, the herbs like seasoning in your foods. But for some people, if they have an aversion to salty taste. And so then you tend to steer towards more bland foods and avoiding salt additive into your food. So it really just kind of depends a little bit on what the taste is that they are experiencing, and then you can tailor it accordingly.
Yeah, I think other things to potentially add, just some little tricks, is if people have the metallic taste in their mouth, they may want to use just plastic utensils, not actually utilize like, metal utensils, because sometimes that can exacerbate. Making sure there's good oral hygiene, brushing the teeth with soft bristle toothbrush to prevent, any ulcers or anything like that. Sometimes some people will do some rinses. If some people get kind of irritation in the mouth or the mouth is very sensitive, there's a magic mouthwash that can be used that has kind of a numbing sensation if there's irritability in the mouth or irritation in the mouth. So I think those additional things, trying foods with different temperatures, sometimes it's the warm temperatures can exacerbate sometimes that metallic taste, and sometimes cooler temperature foods may be better. So playing around with that. And there's been some very mixed data about potential zinc supplementation with regards to getting rid of that metallic taste. I don't think we have anything finite to go off, but there is some data that's out there about zinc.
I think one other thing to add would be baking soda and salt rinses. So although we kind of classically think of that as sort of mucositis manage, sort of strategies, it can also help kind of neutralize the flavor in the mouth before people are eating. So baking soda and a little bit of salt, warm water.
Thank you for a lot of practical good advice there. We're moving on to our last topic 5, which is weight loss in kidney cancer patients who are under treatment and how to either avoid it or manage it. And so, I'll sort of tee it up here. It can be challenging. We've got 2 different questions from 2 different perspectives. One's from the patient and one's from the caregiver. And I'm going to let you hear from both Tammy from Florida and Julie from Virginia. Why don't we start with Tammy?
Hello, everyone. My question is, how do you gain weight and how do you keep it on?
Yeah, very, very good question. I think when we think about weight gain, I think it's really about calories, the amount of calories that people are getting in a day. If you want to gain weight, you need to be in a calorie surplus. If you want to lose weight, you got to be in a calorie deficit. And if you want to maintain, you got to be in a calorie neutral. And so, there are a lot of ways that people can actually track their caloric intake. Eating, sometimes when it's a volume issue, like you can't eat big meals, like eating foods that have high calories, that are very nutrient dense, can help, whether that be shakes or, protein or, kind of like Archana was saying, avocados, nuts, those kinds of things have a lot more calories to them. And can be kind of integrated into the diet. There's also apps that people can have on their phones to track their calories, and depending on whatever it is their goals are from a nutrition standpoint, whether they want to be in a surplus or want to be in a deficit, you can actually track your caloric intake. So a very easy app that's free is called MyFitnessPal. You can actually track your daily calories. The paid version, you can actually just scan barcodes, and you can scan the barcodes and say, I had a serving of this, I had a serving of that, and it'll actually track your calories that you've taken in for any given day. And you can put what your calorie goal is. You can work on that with your nutritionist and then track on a daily basis. It's very easy.
All right. Well, thank you, Tammy. Appreciate that question. I think we also have a question coming from Julie.
Hi there. This kind of is on the same lines, but as a caregiver, what suggestions can you provide me to help my husband maintain his weight without us both feeling he is being force-fed? And in addition to any meal choice tips, do you have thoughts on ways to support the difficult task of eating more than he wants in a positive way?
That's such a great question. And I want to acknowledge and recognize, the importance of caregivers. And thank you for being that person for your husband, because I know that that's a really important, that's a significant role. And there's a lot in your question that I think is critical that we answer. So in addition to what Dr. McKay said about sort of prioritizing, small frequent meals throughout the day, I think a couple of other tips would be that, you can try to schedule meals or smaller meals. So make every bite count, but make the bigger sort of portions, or potentially if you know that the mornings are better, then focus the energy on the mornings. If that's, your husband's rested the whole night, they may be more apt to eat better in the morning than later in the day when they're more tired, or, whatever it might be, maybe more full, etc. Other things that you can do, kind of keep portable snacks with you, right? So wherever you might be, that there's something that you can offer every hour. And it doesn't have to be a large amount. It could be cheese and crackers. It could be peanut butter and crackers. It could be, but something that really is high value, right? A lot of calories in a small amount. So dense. Other things we've talked about earlier today, smoothies or milkshakes, Ensure, Boost, those types of things, again, that are calorically dense, maybe not requiring a lot of chewing or, having strong taste to it, but you could really throw anything in there. In a smoothie, you could put yogurt, you could put peanut butter, you could throw ice cream if you wanted it there, and it's calorically dense, and you could sip on it throughout the day. So it doesn't have to feel like, here's your meal, you have to complete all of this, but it could be something that's sort of, used throughout the day. In terms of the second part of your question, which was more about kind of creating positive energy around it, I think one thing to consider is, try to have meals planned with other people or in an environment that is positive for the patient. That way it kind of takes the pressure off, needing to it be so focused and rigid, like this is the time it's scheduled, you have to eat, but rather it's a social environment and it's a positive experience for the patient.
Yeah,
if you want to add anything.
I can't emphasize that enough, is that to create that positive eating environment and not have it be an onerous task, because then it becomes burdensome on you as the caregiver and on the patient. And there's this sense of, I'm not accomplishing the task and I'm failing. That should never sort of be how we approach sort of food and kind of working to build up people's calories. Celebrate the small victories, celebrate the small wins. Planning meals around social events and social environments with other people. We tend to eat more in social gatherings with others than when we are by ourselves. So subconsciously plan a friend to come over for lunch, or we're going to go out to your favorite restaurant, and actually identify what the favorite foods are. And they may vary from day to day depending on what somebody is going through, but sort of, trying to facilitate that and focusing on the quality as opposed to the quantity is probably better, and making sure that the hydration piece is taken care of. And then you can focus on quality food items, getting those in, eggs, smoothies we talked about, peanut butter. Everybody's got different tastes, and celebrating the small wins. And I think there can be a lot of caregiver burden as you're caring for a loved one who has illness or has a metastatic condition. And so not to take that personally. I think a lot of times we want to take it personally, like, oh my gosh, like I'm doing something wrong. I think that's certainly not the case. And we want to make sure that the care team, the nutrition team, can support you as a caregiver in making sure that you're supporting your loved ones through their cancer treatments.
Thank you, Julie. Maybe for our next town hall, we should all bring some food with us to this little snack along the way. Thank you very much for that. I've been dreading this word all week. Can you speak to cachexia and what that is, and what should a kidney cancer patient look out for?
Yeah, happy to speak about that. That's when patients have, it's basically a complex medical condition that causes severe weight loss, muscle wasting, loss of appetite, fatigue. And as I stated earlier, there's been studies that have demonstrated that cancer cachexia is actually associated with negative outcomes when people are on treatment. So I think it's really critically important to kind of identify individuals who may be at risk for that, who their BMI has really dropped down to the underweight region, where they really need to be seeing a nutritionist or plugged into sort of a nutritional program where there's adequate supplementation. Something that we haven't really talked too much about have been, appetite stimulants, and there can be appetite stimulants that can be used in those extreme cases. There's not a lot of great magic pills, but there are some medicines that are out there, Remeron, Megace. Some patients may even try cannabis in the regions where it's actually approved for use and it's legal to use. And there's different formulations from oils to gummies and different things that can be utilized. So I think it's critical to sort of be on the lookout for that, where you're seeing people having a lot of muscle wasting, getting them plugged in, and being very proactive around the cachexia.
Great, great. Well, thank you for that clarification. We are coming down. I misspoke. We do have one topic we want to touch on real quickly, which is when to ask your medical team for help. And so could you tell the audience when they should ask their doctor or their nurse practitioner for help with weight, what kinds of resources they might be able to find, or any other information before we wrap up here?
Ashley, you want to take that
Start.
one?
Yeah. I mean, I think what we advise our patients is that if you have any questions at all, we're here for you. This is a journey. It starts from the very beginning, from the first week that you're on treatment. Symptoms come up, we want to hear from you. The earlier we intervene on things, the easier it is to manage. If we let weeks and weeks go by without seeing a patient or hearing from them, the harder it is to sort of play catch up and know what actually is happening. So we can always bring people in. So encourage everyone, reach out early, because that's how we can intervene quickly. And to Dr. McKay's point, the longer that we let things go, the harder it is to sort of to catch up. In terms of resources, we have, we're very lucky. We have nutritionists here. We have great multidisciplinary services. But I'm sure that, everywhere out in the community and at other, big centers, there are these resources available. So ask for it. Ask about a nutritionist or a dietitian to work with. They're really a wealth of knowledge.
I think the one other thing to maybe chime in is actually the utilization of palliative care resources and specialists. I think sometimes there's this like negative stigma associated with palliative care. Actually, palliative care begins right at the beginning when people are first diagnosed, and there's been data to suggest that early palliative care is basically symptom management. It's working with a team that is aggressively focused on symptom management. Early palliative care actually improves outcomes for patients with cancer. And so, what's causing the lack of, the nausea, the GI side effects, sometimes it's actually poorly controlled pain, and actually getting somebody's pain in check is going to help their appetite. So I think working to understand that is really important, and don't shy away from palliative care resources. They can really be there to help people.
Wonderful, wonderful. Last question, which is everybody's going to have Thanksgiving next week, I think, most people. Any advice, any thoughts, any last minute moderation comments?
Enjoy it. Be with your loved ones. Celebrate the day. There's so many things that we are grateful for every single day. And I think it's actually a day to step back and think about all the people in your life that are making a positive impact, and all the things that you're grateful for. I think regardless of the situations that life throws at us, we have a lot to be thankful for. And I think putting that in perspective is really important, and enjoy the feasting. But it's all about the family,
Great, great. Thank you so much. Thank you, Rana. Thank you, Archana. I really appreciate you all being here. Thank you, audience, for sticking with us for this hour. Really appreciate you paying attention to all this really interesting information. I also want to say thank you to our sponsors, Aveo and BMS, ASI, Exelixis, and Merck. And if you'd like to rewatch this town hall or share it with your family and friends, it'll be available on our YouTube channel by the end of the week. And once it's uploaded, you'll receive an email from us and link it to it links to other resources and share it with whomever you can. I hope you all have your 2025 calendars out, because in January 30th, which is a Thursday, January 30th at 1 p.m., a new time because we're having a special guest from Europe join us. We're going to have a town hall on looking forward and looking backwards on the last years and forward years. And it's going to be Dr. Laurence Albijé from Gustave Roussy in Paris and Dr. Samantha Monti-Powell from out in California, City of Hope. January 30th, mark your calendars, 1 p.m. Please follow us on Twitter and Facebook and Instagram. You can get our latest updates. We're having that community social right after this. The link should be in the chat box. Just want to say thank you again for helping us accelerate cures. Happy holidays from all of us at KidneyCAN, and here's to your good health.
Thank you all. Thank you, Brian, for a wonderful moderation tonight.
Oh, thank you.
Thank you.
Thank you, everybody.